Welcome to Apollo Spectra Facebook Live session. It is an interactive session that regularly happens from Apollo Spectra Hospital, MRC Nagar, by our top specialists from our different medical and surgical departments. We hope you tune into the section and ask our doctor for any query you might have. We introduce our ENT surgeon, Dr. J Niranjana Bharati.
Good morning. I'm here to discuss with you a topic which is a major issue in almost like every household that I know of, or rather, even in my household. So, what is this major issue that we all face? It is snoring. So, do you think snoring affects only like one particular person or one particular gender? No, it happens in like every household where it's more common in males because of their increased body mass. So these people who snore, what happens is they actually don't realize that they are snoring, and they are usually brought into the hospital by either their spouses or their friends, relatives, and household members. So do you think snoring affects only people who are with the people who snore? No, it actually affects even the people who snore. So what does people who have snoring get? They also get into something known as obstructive sleep apnea, which is a major health concern, especially in today's time, because I've been seeing more cases of obstructive sleep apnea post COVID. Why post COVID is basically because we've all been leading a very sedentary lifestyle. We've all been under lockdown, and we've been hogging on to food like whatever that we can get off, and we've not been having any physical activity or anything during that time. So we've all landed up in more body mass, which has in turn led to more snoring and more obstructive sleep apnea. So, what basically is obstructive sleep apnea? Obstructive sleep apnea is that we pause for a very short while or for a few seconds when we sleep. We pause or stop breathing, and then we start resuming to breathe. So, how does this affect us? This stopping and breathing actually makes the oxygen level in our body go down. So, our body automatically starts waking up, and we try to gasp into more breath, that is more oxygen, to keep ourselves like sane. So what we are supposed to be doing the whole night, that is we are supposed to be resting, sleeping, and having a proper good rest, we actually don't do that. We might be physically lying down, but mentally we are going to keep ourselves awake, and so we feel more tired and fatigued the next day, which is going to lead on to more and more health problems. So on today, we'll discuss more on what is obstructive sleep apnea, how it affects people, and how we can treat it or rather prevent it, and what we can do about to have a more healthier lifestyle. So does obstructive sleep apnea affect only one age group of people? No, it's actually not like that. It affects like a large age group of people. And also in the present scenario, a lot of children are also getting affected by obstructive sleep apnea. So we need to diagnose onto what obstructive sleep apnea is, how we land up in that. So the basic thing that we get for a person to know that they have obstructive sleep apnea is when they are not fresh the next day, we actually ask them to come to the hospital and get themselves checked or treated about it. So how do they know? I mean, there are a lot of college students or office goers who stay alone in an apartment. So how will they know that they are snoring? They wouldn't know because they don't have anybody around them to tell that they snore. So how they will know is when they wake up the next day morning, they wouldn't feel that they've slept all through the night. They feel unfresh, or they feel very tired. They wouldn't like want to get up in the morning, go to work or do anything. They'll feel tired. So that is when they need to actually think about how their sleep has been, which is a major sleep related disorder that we see today. So they have to get themselves treated to prevent themselves from future major risks like hypertension, heart disease, stroke, diabetes, and a lot of other health issues. So how we can treat is we can treat them using a very healthy lifestyle, eating proper food, exercises as the main thing to get rid of obstructive sleep apnea. And we can also think of other treatment modalities like CPAP and surgery to go up with it. So children, we need to treat them more intensively, because children are they cannot like cope up as much as adults do. So they need like more oxygen, they need more energy to get through their life. So they'll be more tired, more fatigued. They also lead into impaired concentration. Their growth might get affected, their studies and everything will get affected. So we need to treat the whole spectrum of age group, that is from children to the adults. We need to see and we need to treat them. So snoring is not just something that we feel, okay, yeah, I've like snored, so it's okay. It's just not disturbing for the people next to us, but it's also disturbing for us and for our own health. So let us get into that.
So, as you explained, ma'am, is snoring and sleep apnea the same one?
No, like snoring is a symptom of sleep apnea, but not everybody who has snoring has to have sleep apnea. So snoring can happen even due to a mild cold that a person has, or any small obstruction that a person has, they can have snoring. So not everybody who has snoring need to have sleep apnea. So sleep apnea is where we have short pauses in our breath when we sleep. So that does not happen like in all cases of snoring, whereas obstructive sleep apnea related snoring, yes, it has short pauses in breathing. And obstructive sleep apnea can be due to many reasons. It can be either due to a central cause, that is due to a brain disorder or a lung infections, or due to any brain stem disorders, everything they can have sleep apnea. So this obstructive sleep apnea is a very common type of thing, where snoring is also a symptom. Not central sleep apnea need not have snoring in it.
Okay. How do we come to know that we have sleep apnea? Are there any symptoms to recognize that?
Yeah, exactly. Like I was just telling you, sleep apnea, the main symptom is snoring. Whether we realize or not, the people next to us will obviously tell us that you're snoring a lot. I can see a lot of people, like wives usually bring their husbands telling that they snore so badly, their sleep gets disturbed, and in turn, their livelihood, everything gets disturbed. So, snoring is like one main symptom. But for a person, even for a person who lives alone, they can realize it by the next day. Like when they wake up, they're not fresh in the morning. Like basically, as I told you, we when we pause for a short breath, what happens is our brain automatically, the oxygen level in our body goes down. In turn, there is a carbon dioxide overload in our body, which makes our brain wake up. So when our brain wakes up, we gasp for more air and we try to compensate for the oxygen that we have lost in our body. So when we are physically lying down, we are also supposed to be sleeping and being under complete rest. But what happens is we wake up, our body unintentionally wakes up and it's working when we are supposed to be sleeping. So when we wake up the next day morning, we might have had 8 hours of bedtime, but in turn, we will not have had 8 hours of proper sleep. So the next day morning, when we wake up, we don't feel fresh that we've slept all through the night. Instead, we feel tired. When we feel tired, our the whole day's work, no, it gets disturbed. We are not able to do our work properly, our concentration is disturbed, we feel tired, we feel very sleepy. So all that we have to check. So when we have symptoms like this, I think it's better to first get checked to a doctor whether we have a sleep disorder or the main symptom is obstructive sleep apnea.
So, how would we treat obstructive sleep apnea, ma'am? Is there any prevention or any surgery is there for that?
Yeah. So obstructive sleep apnea, it's basically like we need to first diagnose onto why they have that obstruction. So the first thing that we have to do is a proper clinical checkup. This proper clinical checkup in the sense, this obstruction, the air flows into our body through our nose, mouth. So we need to check whether there are any obstructions first in our nose, mouth and all. Like for example, there is a septum which can get deviated, or due to chronic sinusitis or chronic allergies, we can have polyps in our nose. So all that can also cause an obstruction, which in turn can have snoring. In the same way, in our mouth, we can have enlarged tonsils, which can also cause an obstruction. So we will have to first check on to why we've had that obstruction. And the main thing to first check on whether we have obstructive sleep apnea or not is known as a sleep study. Nowadays, it's very easy to get a sleep study done. You can even get it done at home. It's known as a home sleep study. This home sleep study basically monitors our sleep the whole night. So a person will come home, they will fix up leads for you. So these leads will monitor the ECG, that is your heart rate and how your heart functions through the night, our abdominal movements, our chest movements, our eye movements, everything. it checks onto how we are responding to everything in our sleep, like how much is our oxygen level in our body, how low it goes or how high it goes, how many times we have paused to breathe during the night. So how many times we pause during a minute, during an hour, and during our whole 7 or 8 hours of sleep. It monitors everything, and the next day morning there is a graphical recording on what you have done the whole night of your sleep. So that helps us decide on to whether you have obstructive sleep apnea or not. So with that, we'll have to see on how we can treat you, whether it's mild, moderate, or severe. We'll have to treat accordingly. So the main treatment or thing for sleep apnea is, after the sleep study, we'll have to do something known as a drug induced sleep study. So this drug induced sleep study is nothing but an endoscopy done for our nose and our throat in with a mild anesthesia, which will mimic our normal sleep. So it can be done only at a hospital with a mild anesthesia. And when we introduce an endoscope at that time, we will know where and all in our nose or throat our muscles are constricting or contracting, causing the obstruction for the airflow in our body.
So, as you already told, even children used to snore and they have so many problems. If it is untreated in children's or in the various adult groups, what will happen, ma'am, if it is untreated?
Yeah. So in children, we also need to think about a few other factors on obstructive sleep apnea. What in children, the most common thing is that they just like we have holes in the front of our nose, we also have holes at the back of our nose. So that is when it is closed congenitally. So that is known as a choanal atresia. So when that is closed, also there is obviously an obstruction to the flow of air to our body. So they can still snore because of that. So we need to see on why children snores. In children, adenoids or tonsil is very common. So they can also start snoring because of that. So we have to check on why children are snoring. So when we do not treat children accordingly, see, a sleep is very, very important for the growth of a child, and sleep is very important for their concentration. So what happens is, when we do not treat children right on time, what they do not get a proper sleep, so their growth is delayed, their height or their general growth is delayed. Also the facial structure, because it's a growing stage, and the bones of our face, they keep growing till we are like 16, 17 years. So till then, when there is a impaired sleep, when there is impaired oxygen supply to our body, or the breathing routine is changed, their facial structure also changes. So we need to check on to all that when we treat children. So if we do not treat children, yes, as I told you, their growth will get impaired, their concentration will get impaired. Also, this constant breathing difficulty can also lead to stress, diabetes, stroke, hypertension, and everything.
Okay, ma'am. So, does asthma also play a role in sleep apnea, ma'am?
See, asthma is a lung-related disorder where there is a wheeze, and they have a difficulty in breathing. That does not have anything to do with obstructive sleep apnea. So it's more of a obstruction, or it is known as COPD, that is chronic obstructive pulmonary disease, where the obstruction is in the lungs and not in the airway. So for those people, there is no point in seeing like where there is an obstruction. They can have a sleep apnea because of that.
So, as you already told, there is a sleep study and drug induced study. And are there any other tests to identify sleep apnea, ma'am, other than these?
See, the gold standard for sleep apnea is a sleep study or a polysomnography, which monitors everything in our body during our sleep. So that is the gold standard. And the next step to do is a drug-induced sleep study to know where, in what levels the obstruction is taking place. But there are also other things which we can do prior to this to know where the obstruction is. Like, for example, I spoke also about a deviated nasal septum, about polyps, about tonsils, adenoids. So what we can do is, we can also do a diagnostic nasal endoscopy to check if there's any obstruction in the nose. We can do a proper clinical examination to check. We can do a CT scan of the paranasal sinuses to know if there's any structural abnormality in the nose, septum, everything. Okay, we can also do a X-ray of the neck to know the posterior airway, whether there is any obstruction in that. So all these tests also help us to know where the level of obstruction is.
So, what is CPAP, ma'am? Will it really helps in reducing the sleep apnea?
Okay, CPAP is a small machine. It is known as continuous positive airway pressure. So what it does is for people who have sleep apnea, they when they sleep, as I was already telling, their breathing pauses for a few seconds and they start breathing again. So in that phase only, our sleep gets disturbed. We might sleep and then we suddenly wake up, we gasp for a breath, and then we take a breath and then we sleep again. So what the CPAP machine does is it regulates the pressure in our body. It is a continuous positive airway pressure, so it like reduces the obstruction, and it keeps giving air to our body, so our sleep is not disturbed. So for people who use a CPAP, it actually helps in cases of obstructive sleep apnea, because obstructive sleep apnea is again like a cycle. See, you lead a sedentary lifestyle, you put on weight, your BMI increases, your body fat, your abdominal fat increases, the fat in your neck and thing increases, so you are tired. You have obstructive sleep apnea, you're tired the next day, you're not able to wake up, you're not able to exercise. In turn, you again put on weight, again your sleep apnea increases, again you're tired. So this keeps happening like a cycle. So this cycle has to be broken at some part of time. So this CPAP helps in breaking that cycle. So what happens is this CPAP gives like positive air to our body. It maintains the pressures in our body. It maintains the oxygen level in our body. So when it does, we have a proper night's sleep. So along with the CPAP, we'll have to again like do our exercise, our dietary modifications, stay on a proper diet, stay on exercise. Main thing is weight reduction. That is a main treatment for obstructive sleep apnea. Yes, CPAP does help. And
So, is there any side effects on using this CPAP, ma'am?
yeah, CPAP, there's no actual side effect as such, but not many people are comfortable in using a CPAP because this is a machine and it comes with a mask for the nose and the mouth. So, like, not everybody will be comfortable in sleeping with a mask all through the night, right? So, that is there. Also, when this air pressure is there, there is also there is dryness of the nose. So, this dryness can in turn cause like mild bleeding from the nose. So, that is a side effect of CPAP. Also, when this air pressure is there, it can in turn cause like mild bleeding from the nose. So that is an actual side effect for CPAP.
So, once after they start using the CPAP, is it required to use lifelong, ma'am?
Yeah. So as I was just telling, the CPAP is like, yes, it could be a lifelong thing for people who have like severe sleep apnea. But for people who have mild to moderate, they can also, like when they are out of the sleep apnea, they can also stop using CPAP. That is like when it's mild, they can, this body weight reduction and everything, it can help reduce the episodes of apnea. So we can again repeat a sleep study. We can see like whether how their sleep apnea is, whether it is reduced when they are completely out of it, when they are completely out of.
So, as you already told, the dietary modification, the main thing would be the weight loss. So, the diet to be followed would be only for the weight loss, ma'am, or any other particular thing to be followed?
Yeah, diet modification in the sense, a lot of people, we hog onto junk food, especially eat on time. They are always out. They have like their office hours are totally different, so they keep eating like fast food and stuff. So these dietary modifications will also include like having a lot of fruits and vegetables, reducing on their junk food. These things will help in reducing the weight. Also, we'll have to reduce on the oil content in our food. It will also help reduce acidity, which can also, in turn, this acid reflux can also give a throat irritation, that can also cause like irritation in the throat, and that can cause dryness. Again, that can cause sleep disturbances.
So, people who does not snore also will get a sleep apnea, ma'am.
Yes, see, I already told you there's something known as a central sleep apnea. Central sleep apnea happens because of heart diseases, lung diseases, or any brainstem issues. So those people might not have much of snoring, uh, but they can have a sleep apnea. Sleep apnea is basically that the apnea is like short pauses in breath during our sleep. So that can happen even in cases where there is no snoring.
So, people when they travel, how would they use this CPAP, ma'am?
CPAP comes as a very portable machine. You can also use it while travel. There are also aircrafts where you can plug it into. There are provisions in the aircraft also to use CPAP machines and thing.
Is there any permanent cure for this sleep apnea, ma'am?
Permanent cure is only with ourselves. We will have to do a diet modification, lifestyle modification, exercise, and we'll also have to treat the actual things. So when you ask about a permanent cure, I can also tell you about a few of my cases. So there is this patient who came with like a very bad snoring, but he was having a very very large tonsil, like almost a grade 4 tonsil or a kissing tonsil. Kissing tonsil is when both the tonsils come together and they're literally sticking to each other, so it was that bad. So when we do an sleep study, we realized that he had obstructive sleep apnea. And then when we did a drug induced sleep endoscopy, we realized that the obstruction was mainly only because of his tonsils, so and his weight gain. So when we asked him to like put him onto a regular diet, put him onto exercises, when he started reducing his body mass index, and when we operated on him for the tonsils. So along with the tonsils, also we did a uvulopalato-pharyngoplasty. So this uvulopalato-pharyngoplasty is the main surgery related to obstructive sleep apnea. So what we do is we can reduce a part of the palate, which which is also a part in causing the obstruction. So whether when we have a large tongue, when we have a palate which is like not which is a patulous, so that can also cause obstruction in breathing. So when we operated him on the tonsil and when we reduced the palate, he was like out of sleep apnea. So he almost like even like I could say even a week after surgery, he felt a major reduction in snoring. And when we checked his sleep study and all, a month after surgery, it was like literally back to normal. So till date, he does not have any snoring or anything. He's doing like really, really well. So these surgeries are also helpful in cases like when, as we age, just like other muscles in our body like become patulous, they lose their tension. So same thing happens to the laryngeal muscles also. So in those cases, we cannot think about surgery because for elderly people, just like any other muscle, it can happen. So for those people, CPAP is the only option. Otherwise, we can also think about surgery. Surgery, yes, it helps, but only according to the cause of the sleep apnea.
What are the post-operative outcomes, ma'am?
Yeah, post-operative outcomes, it again depends on the cause of the sleep apnea. Like for example, if a patient has only a deviated nasal septum, then we will have to think about operating the septum. This can also like CPAP only cannot help in cases of sleep apnea unless and otherwise. See, sleep apnea when we have where when it is because of your septal deviation, when we use a CPAP, it can again cause a difficulty in like the airway pressure. So the air cannot pass in freely. So this can again cause like difficulty. So in these cases also we will have to like correct the septum and then start using a CPAP.
Okay. Thank you, ma'am. That was very interactive section, and we have got a clear idea about what is sleep apnea. And thank you for the valuable time. Thank you,
Thank you
ma'am.
so much. Thank you.